The highly respected Professor of Epidemiology and Public Health, Sir Michael Marmot, said earlier this year, if you had the hypothesis that the government was seeking to destroy the National Health Service, if that was your hypothesis, all the data that we're seeing are consistent with that hypothesis.
Margaret Greenwood opened the debate. 3 key points that she made were the NHS has been underfunded, and it looks as though it has been deliberately underfunded. Secondly, privatisation has been increasing over time. And thirdly, the economy is heavily dependent on the NHS. If we haven't got a healthy workforce, we can't have a healthy economy. So if the government destroys the NHS, it will, in the process, destroy the UK economy. Footage from the debate illustrates how the Conservatives responded to the point about underfunding. Or actually, they didn't respond to it. They very cleverly used the phrase record funding.
Now, turning first to funding, as my honourable friend, the member for Shrewsbury, and honourable lady, the member for Southend West set out, we have invested record amounts in the future of our healthcare system. And by the end of this Parliament, core spending will have increased from £140.5 billion in 2019-20 to £193 billion in 2024-25.
Why is that, ducking the question? Well, my first salary was £6,500. If that had risen every year by £50 a year, by now I would have a salary which was, for me, a record salary, but which would also have plunged me into poverty. And it's exactly the same with the government's claims. Their so-called record amount of money doesn't take into account inflation, doesn't take into account the fact that the population's grown over the last 13 years. It doesn't take into account the fact that the population's aging. And most importantly, it completely ignores the fact that we have various epidemics which have risen dramatically over the last 13 years, not just COVID, but there's been an explosion in mental health issues and in obesity-related issues, all of which the NHS is expected somehow to cope with. Margaret Greenwood mentioned her concerns about privatisation. The Minister denies that there's been any privatisation.
But this has been a perennial accusation levelled at government. So let me be absolutely clear. It is not our policy, it is not our plan. The NHS is not and never will be for sale.
The Minister said that the NHS is not and never will be for sale. But actually there are 4 ways of privatising the NHS. You can squeeze people out. Last year, more than half of all hip operations were done privately. That's not because people want to spend £15,000 having their hips replaced. It's because they're in agony and the waiting list was too long. Even worse, you can be thrown out. Government simply says treatment X is no longer available on the NHS. And in practice, in many parts of the country, that applies to dentistry, then people have no choice but to go private. That's a form of privatisation. And of course, they can contract out. Many ambulance services now are provided by private companies. So when the Minister says the NHS is not for sale, what he really means is that the one form of privatisation that they are not doing and not planning to do is to turn the NHS into a limited company and float it in the stock exchange or sell it off to a big American healthcare company in one go. The other 3 forms of privatisation, absolutely they're going to be pushing ahead with. One of the other arguments they sometimes use, that privatisation can help by tackling the backlog.
Now, what we are doing, however, is using the independent sector to enable us to fully realise our healthcare system's capacity.
Unfortunately, there is no spare capacity in the private sector. Any private sector operations that are done will be done by NHS consultants, supported by NHS nurses and NHS anaesthetists working privately in their spare time. So it's taking away capacity which could otherwise be used in the NHS, and it costs more to do it privately. And then the last thing is about the staff. All who spoke made a point of saying how much they value and cherish NHS staff.
Of course, I want to put on record my personal thanks to all those working in our health and care system for their hard work and dedication. And of course, we remain deeply grateful to them for all of their work during the pandemic, in facing the new challenges of tackling the backlog, and of course, for the routinely excellent care that they provide day in, day out.
Let's remember, this is the government which is asking them to accept yet another real terms pay cut. Doctors and nurses are paid less today after inflation than they were in 2010. They've been consistently told for the last 13 years that now is not the right time for them to have a pay rise. Understandably, they're wondering if it will ever be the right time. So in summary, the House did debate the future of the NHS. Margaret Greenwood set out some very important challenges about privatisation, about underfunding, and about the pay of staff, and the government ducked all three.